Cognitive Behavioral Therapy: How to Overcome Phobias, Addictions, Depression, Anxiety, and Other Problematic Disorders. Written by Lance Pettiford. Narrated by Mysti Jording. Introduction. Cognitive behavioral therapy has been around in its modern form since the 1970s. Since it was first developed, it's been tested again and again in countless clinical trials and experiments. The most effective parts were kept, and those that were found to be less effective were abandoned or replaced with better ones. All this has resulted in the emergence of one of the most promising and rigorously tested therapeutic techniques ever to exist. Today, cognitive behavioral therapy involves a highly efficient system for targeting your problems, treating them at the source, and developing skills you'll need to prevent that problem from occurring again. And the best part of it all is that you can do this all on your own. You don't have to pay for expensive therapy sessions or attend outrageously priced therapeutic retreats. You can simply pick up a book like this one and learn about the strategies and techniques involved and begin treating yourself today. There are countless proven techniques used in cognitive behavioral therapy methods that have been specifically designed to treat the most urgent problems many of us face in our lives. While cognitive behavioral therapy has been shown to be effective in the treatment of countless disorders, this book will focus on treatment techniques for the 4 disorders that cognitive behavioral therapy has been the most effective in treating. Those 4 disorders are phobias, addictions, depression, and anxiety disorders. With this book, you have access to a comprehensive guide to using cognitive behavioral therapy methods on yourself. In the following chapters, you'll learn more about exactly what cognitive behavioral therapy is, how it was developed, and what the general process involves. The specific techniques that cognitive behavioral therapy uses to treat the 4 disorders mentioned above, including cognitive processing therapy, exposure therapy, acceptance and commitment therapy, or ACT, cognitive therapy, relaxation training, and dialectical behavior therapy. The cognitive distortions that are involved in the negative thought processes and how to identify them. A guide to conducting your own mental health assessment so that you can better understand exactly what's wrong and what needs to be fixed. A guide to cognitive behavioral therapy treatments for phobias. A guide to cognitive behavioral therapy treatments for addiction. A guide to cognitive behavioral therapy treatments for depression. A guide to cognitive behavioral therapy treatments for anxiety disorders. Extra tips for those who plan to use cognitive behavioral therapy methods entirely.
Sample complete. Ready to continue?